Is it right or no? Okay. Yes. Good morning, good afternoon, and good evening to you all, my dear doctors around the world, as well as people around the world. Here, we would like to announce you people that about one of the clinical trials in the case of thyroid complications. The outcome has to be revealed, which is highlighted from the clinical data, which is generated from the clinical trials about the complications of thyroid gland, especially called hypothyroidism as well as hyperthyroidism. I thanks for many of the people, including laboratory people, as well as my colleagues, my friends, in order to put me in such a position for a good clinical trials for the thyroid complications. Nowadays, many of people around us facing too much problem because of thyroid complications. As you all know that thyroid is a gland which is producing necessary hormones called T3 and T4 thyroid hormones, especially that regulate so many metabolism, so many mechanical functions, biomechanical functions, including growth, development, hormone balancing. Everything is controlled and regulated by the small gland called thyroid gland, which is located in neck region. It's the shape of butterfly. Why we are here to reveal some new data which has generated from recently followed, recently developed, recently recognized some new data when we gone through clinical trials of thyroid cases. So we are happy to announce you all the doctors, all the scientists, as well as people around the world, irrespective of any country, because many of the people around us, around you, are facing the problem because of the complications of thyroid gland and lacking of production of the thyroid hormone 3, thyroid hormone 4 tends to make several complications throughout the life. So here the question is that whether we are able to say goodbye to hypothyroidism. Is it? Whether we are able to say goodbye to hyperthyroidism, whether we are able to goodbye to complications related to thyroid gland, the answer is yes, we can. Nothing is impossible. The recent research study, recent clinical trials proves that it's possible, nothing as impossible in case of thyroid problems. As you all know that why the hypothyroidism occur, why the hyperthyroidism occur. As you all know that this deficiency of thyroid production, thyroid hormones causes many complications. The people get obesity, people get too much hungry, anxiety, even hypovolemic shock, strokes, lacking of blood circulation throughout the body, especially ischemic condition, in brain, developmental problems, pregnancy problems, development of fetal problems. So many hormonal imbalance happens, take place because of the thyroid issue. As we all know that TSH is the only hormone that stimulates thyroid gland in order to produce adequate formation of T3 and T4 in order to regulate the all metabolism throughout the body irrespective of the organs and glands. We have to look into the etiology, means the exciting factor, the exact cause behind these complications. We have to do the research work in each system of disease, in each mode of disease. We have to do further research with our heart and with our soul-minded clinical trials. We should get enthusiasm to do many things. We can achieve in each and every point. This clinical trial proves that it is possible to overcome almost all disease irrespective of disease condition, irrespective of name of disease, irrespective of system of medicines also. Around the world we are trying for achievement where we can give more health in order to bring back the health from sick or in disease. So, or in disease means from sick or from disease, in order to maintain the health back to normal harmonious level of the human race. The etiology behind, we found that in the case of thyroid complication, many factors is there. As you all know that thyroid gland is a simple gland that need a proper circulation, means the blood circulation which bring whatever the necessary parameters including iodine, selenium, whatever the requirements for the production of T3 and T4. If the blood circulation is not proper, the thyroid gland will be facing too much difficulty to produce sufficient hormones. It will have the struggle to produce sufficient because of that incomplete or partial blood flow. Because of atherosclerosis, arteriosclerosis, even stenosis will cause even the blood vessels which passes blood to the gland called thyroid gland. The recent study revealed that a person having the thyroid problem, either it may be hyperthyroidism or hypo or hyperthyroidism. What may be that? Most of the hypothyroid case, we have undergone several clinical trials, found that very important data, that is they are affected by certain virus at the chronic level, not in acute level. Why we say about the chronic level? When we go through investigation part of the thyroid patients, we concluded that we reached in a point and we fixed there by observing the data of level of antibodies of certain virus is increased beyond the normal value in each presence of thyroid complicated patients. It means that we measured, normally the scientific people, doctors measure, even it is acute or any pandemic condition or even in the case of any epidemic condition also or any individual case also, we measure immunoglobulin M normally. It happens so around worldwide. But we never try to measure IgM instead of, no, we never do the measurement of Ig instead of IgM. after the acute phase. After occurring the disease may get prolonged for a long time. It may take 6 months more, 12 months, 1 year, 2 year, 3 year, 10 year, 15 year, 12 year, whatever it is, years of this is prolonged. IgM will not prolong for a long time beyond 2 or 3 years. Minimum time it is 6 months, but according to several individual constitution, it may lead to up to 1 or 2 years also. Immunoglobulin M will end at there. If the immunoglobulin M is not able to overcome when a particular virus comes in body, it enter in the bloodstream, automatically the immune response will get alerted and it will get activated in order to produce sufficient antibody in order to kill as well as to neutralize the antigens as well as to take place of macrophages to engulf and destroy the virus. So a person having the capacity to produce sufficient adequate formation of such immunoglobulin M, he can neutralize, he can remove the viruses from his body. But in the case of a person doesn't have that much capacity to produce sufficient antibody M, immunoglobulin M, the patient may fail to produce sufficient antibody and the virus will replicate more and more in the body throughout the circulation. In that time, the immune system will produce IgG, immunoglobulin G, instead of M. So we measured immunoglobulin G of each and every thyroid patient through the investigation part of the blood test as well as other tests also. So we found that 100% of the thyroid patients having chronic disease of viral infection. We can conclude, in several cases we found that it's a viral syndrome. One or more virus was present and it is present in each and every individuals of thyroid patient. So, what causes these virus in the complication of the thyroid glands? The capacity or the character depends on the character of the virus. What may be the virus? It has the capacity to replicate by entering the host cell, by hijacking the biological mechanism in order to replicate inside the cell by using the cytoplasmic material including endoplasmic reticulum, Golgi apparatus, whatever it is, for their replication. So each virus consider each host cells of our cells as a factory. So what will happen? Our cell capacity will get reduced so that it will give signals to immune system by producing sufficient cytokines, interleukins 1, 2, that category, in order to give the signals. These are the signaling enzyme produced by the host cell itself when it gets attacked. When it gets attacked by such a virus, definitely the antibody stimulation will be take place through the signaling enzymes. Either it will give the commands to, or it will give the signals to T cells of the lymphocyte or the B cells of the lymphocyte. When the T lymphocytes fail to overcome such circumstance, definitely the B lymphocyte will take charge and it will produce sufficient antibody in order to eliminate the virus, what may be the kind of virus. But even though after producing IgG, a person is not able to produce sufficient antibody in order to clear the virus and its production called antigens. To form an antigen-antibody complex, the amount and the volume of the antibody has to be raised, because through the replications there will be more productions of antigens according to the replication of each virus. As well as when there is a lack of antibody which is required exactly than the volume of the virus, than the volume of antigen, then only the antibody can, this specific antibody can neutralize such virus as well as antigens. Here, the persons not able to produce sufficient antibody by the lymphocyte, B cells of the lymphocyte, they will get more complications, not only in the case of thyroid gland, most cases of several glands and organs. Normally, we have seen a large variety of virus around us. We can call like that mumps virus, rubella virus, adenovirus, polio virus, SARS coronavirus, Nipah virus, dengue virus, chick virus, Nipah virus, Ebola virus. This kind of virus and more than that of many viruses there around world. But these viruses have a different character, different structure, different size, as well as different material structure. It can be either RNA based one or DNA based one. But whatever may be the condition, most of the viruses have its own hemagglutinin around its envelope. Hemagglutinin is a substance that can cause the coagulation of the blood cells when it's entering the bloodstream. Normally, depends on the character and depend on the volume, depend on the density of these hemagglutinin, the patient gets coagulation in very low altitude, very low amplitude and high amplitude. This coagulation causes thrombosis formation that leads to partial ischemic condition towards the thyroid gland also. This partial ischemic condition, it means there will be half blockage of the blood vessels which causes half supply to the thyroid gland. Normally, the half blood supply to the thyroid gland will make to struggle by the thyroid gland to produce and receive minerals called selenium, minerals called iodine, whatever may be the required parameters, as well as to produce these thyroid 3 and thyroid 4 hormones. In case of hypothyroidism, many of medical specialized doctors can see that excess amount of thyroid stimulating hormone, that is TSH, can seen in blood stream throughout it. But don't fear about that. The thyroid stimulating hormone is produced by pituitary gland or is excreted by pituitary gland via hypothalamus and related to that system. Actually, whenever there will be deficiency of necessary thyroid 3 as well as 4, the negative feedback or impulse will pass to generate more TSH in brain via pituitary gland in order to get stimulation, in order to provide the stimulation to thyroid gland. When there will be lacking of production, when there will be less amount of production of T3 and T4, definitely TSH has to get the stimulation. TSH has to give the stimulation so that it is increasing in the blood level. Whenever the T3, T4 production is to be maintained normally, there is no need of the increased level of TSH. Automatically, pituitary gland will not secrete, it will stop the secretion, excess secretions. That is the normal procedure. So many of the people is worried about their TSH level is very high, but it's a normal thing. Don't fear about such things. Why it is normal? When T3, T4 production is very less, it is a normal duty of the pituitary gland to release more and much TSH in order to stimulate this thyroid gland. Unless and until the stimulation by the TSH is not taken place, thyroid gland is not able to produce sufficient T3 and T4 thyroxine. So that it is not necessary to go behind the TSH level whether it is increasing. Don't take that much stress behind that TSH. But you have to take the stress behind the thyroid gland, why it is not producing sufficient T3, T4. What happened to thyroid gland? What is the struggle take place in thyroid gland? We discuss here that normally thyroid has to be reached proper blood circulation in order to maintain its normal functions. When there will be lacking of blood circulation due to several reasons like atherosclerosis, arteriosclerosis, stenosis, even certain case of aneurysm, even certain case of coagulation, thrombosis formation, plaque formations can be taken place. See, these things will cause improper blood circulation to the organ thyroid gland. So, it is very important to understand through the blood investigation whether thyroid gland problem occurred in the patient because of any coagulation of the blood supply, any blockage due to atherosclerosis, or due to stenosis, or due to stretching. So we can conclude by measuring the clotting time of that same patient. If the clotting time is less than 5 minutes, make sure that there is a chance to get more coagulation. There is a factor behind, there is a etiological factor is there behind immediate coagulation. The normal value of a clotting time in a healthy person, it should be beyond 5 minutes and less than 11 minutes. Normally, average it should be 6 minutes to 9 minutes. But a person having low clotting level means below 5 minutes, if they have the clotting value, make sure that coagulation takes place immediately than other healthy persons. Second thing is that this antibody IgG test will reveal that presence of virus in the body. So, in order to eliminate these virus, we have to produce sufficient antibody, or we have to support that patient in order to make more and more antibodies naturally by the law of cure. That means by the natural law of cure. The body system, the human system, not only the human system, every animals including human being have an autoimmune system, and the immune system have very much intelligent power to organize in order to maintain the normal harmonious, normal healthy level in organism. Normally, in such case, whenever there will be presence of certain virus, in the body through any of the reason. Either it can be acquired or hereditary or any vaccine generated or any mode of entry. What may be the mode of entry? It doesn't matter. It shows that presence of virus. The method to measure the presence of the virus, we can directly check for whether antibody, specific antibody produced in a bloodstream of a particular virus. So if we find the blood investigation part in order to diagnose whether there is any kind of specific antibody beyond the level of normal value. So if we go through IgG mumps, IgG rubella, IgG measles, IgG chick, so we can find certain level of antibody beyond the normal value of that specific virus. The similar way, thyroid patients have this kind of virus. So this kind of virus will cause the improper function because of these set conditions, like improper circulation of blood towards the thyroid gland. Thyroid gland doesn't have any problem, even though blood circulation, if it is not take place in a proper way to this thyroid gland, there will be problem. So it is our duty to remove that blockage. It is our duty to remove the virus in order to bring back the normal function of the thyroid gland. So it is very simple. I recommend all of the doctors and scientific people behind this thyroid complications, as well as the people who suffer from the thyroid problem. I strongly recommend that just you go through the proper investigation part of IgG mumps, IgG rubella, IgG chick, or any specific virus, so that you will find certain level of or excess level of antibodies of specific virus. So don't fear in such condition, but make it fixed that you make sure that you have already affected in chronic level from long time your blood contain virus. But it is simple, very simple. You remove this virus by providing sufficient antibody, that is specific antibody to that specific virus. Whether if it is mumps virus, there will be production of specific antibody to that mumps virus by the lymphocyte. You don't need to do anything towards the lymphocyte any activity. The lymphocyte will be able to produce sufficient specific antibody in order to specific virus. If it is rubella virus, the lymphocyte will produce, it has the capacity to produce specific antibody against the rubella virus. But in many of the thyroid patients, it seems that they are not capable for producing sufficient antibodies in order to maintain the adequate formation of antibody in order to neutralize whatever the virus came in that body. This is because many factors. Nowadays, people are running behind time and money. They are not taking care of their body. They are not taking care of their directions and instructions given by the doctors. They are not taking care about their health. They are not taking care about their liver, lungs, kidney, thyroid gland, brain, their hand, then body parts. They are running away from there. I don't know why. It may be because of improper knowledge about their life. So, my dear friends, see here we are all in this life, but make sure that you should care about your health properly in order to supply, in order to provide sufficient good material to your body which is required by your normal body. in order to maintain normal metabolism. If you are taking unwanted, unwanted material as a food particles instead of good material, see, there are rich protein, rich vitamin rich and delicious foods are available around world, but we are not taking this delicious food also because we don't have the time. Where are you running there? See, long is bad farming. Nowadays, who is farming? You are going to buy some material, food material from market only. Why don't you want to plant some food plants for your own body? Or else you will get rich kind of delicious food from the market also. If it is available, if it is organic food, you go through that in order to maintain sufficient proteins. Because why we are saying these things, for the sufficient production of the antibody which is produced by the lymphocyte only, it requires many numbers of many quantities required for the production of antibody. What the protein is necessary, because the building block of these antibodies are proteins. Unless you get proteins sufficiently, the lymphocyte cannot produce sufficient antibody in order to eliminate the inimical agents like virus. So we are recommending you that also take delicious food in time, and rest of the things you can do after that. So first of all, I was saying that we have to diagnose these parameters: IgG mumps, IgG rubella, IgG adenovirus, IgG chikungunya, in order to find, at least you will find one or more presence of virus in thyroid patients. So we have to stimulate them, the thyroid patients, in order to produce sufficient antibody. That should be the treatment, instead of providing thyroxine throughout the life. So that is why we clinically proved that in many cases, without in thyroxine T4 supplement, we stimulated lymphocyte in order to produce sufficient antibody in order to neutralize these viruses were present in the body of thyroid patient. Automatically, after a particular time, after cross-checking also, we found that this virus got eliminated and the sufficient antibody produced beyond the normal level increased, and thereafter by neutralizing is gone back after the course of production. Automatically T3, T4 start to produce and it came to normal state. Then TSH got reduced and the normal thyroid function took place. So many people said goodbye to hypothyroidism as well as complications related to thyroid gland. Here we are pointing out only thyroid gland. The same thing will happen in each organ in the same manner. But here we are giving this instruction and this recommendation throughout the world for all the doctors. So please kindly, you can recommend your patients for IgG mumps, IgG rubella, as well as certain viral antibody investigation in order to find out and fix their problem, in order to clear out the problem of the thyroid complication, so that the patients, those comes to you, the people around us will be free from thyroid complications. They will survive from thyroid complication in such case. There are two types of therapy that can stimulate the lymphocyte in order to produce sufficient antibodies if the virus is present. Yes, exactly, it will be present. So what are the therapy mode of therapy that you have to follow, that you have to provide to your patients, to the public, those are suffering from thyroid problem? These two type therapies there. One is natural immunotherapy, another one is artificial immunotherapy. As you all know that the artificial immunotherapy is also nowadays take place even in the case of COVID-19 case. What happens? Plasma therapy, antibody therapy, these are the artificial immunotherapy when the patient is not having the capacity to produce sufficient antibody in order to eliminate COVID virus, SARS-2 coronavirus. I am not going to discuss about anything related to this COVID-19 pandemic, but right now I am just giving an example for antibody therapy or artificial immunotherapy. But you have to take all the protocol given by the health department of each state, each country, in order to maintain your health, to avoid droplet transmission. You have to wear your mask as well as what are the directions given by the health department in order to keep your health, in order to maintain your health. So what we were discussing that there is two type of immunotherapy in order to overcome thyroid problem. As I said, second one is the artificial therapy, that was like immunoglobulin therapy, antibody therapy, or the same therapy is taken from plasma therapy. The first one is that the main one, it comes under the natural law of cure, that means natural immunotherapy. Because if we are providing artificial immunotherapy, there will be specific antibody you are collecting to provide these antibodies to a patient. By that time, if the virus gets mutated, it is very difficult to provide another specific antibody for that mutated virus. When you are trying for another mutated specific antibody for the mutated virus, you will prepare for that also. It will take long time. By that time, the virus again tend to another motivation, other mode of character, that is again is mutated. There will be specific in that. So it is better you don't go for the artificial immunotherapy. Better it is go for this natural immunotherapy. That is the first category. You have to give the priority for the method of the treatment in thyroid complicated case for the people around you and world. What exactly the natural immunotherapy do? The natural immunotherapy means that you have to stimulate the lymphocyte activity as well as host cell activity in order to produce sufficient cytokines, interleukins, histamine, whatever it is, the signaling enzymes. So these signaling enzymes, if you are stimulating the host cell, the host cells itself will produce sufficient and adequate formation of these signaling enzyme, which will lead to give the stimulation to T lymphocyte as well as B lymphocyte to produce sufficient antibody. If the cells are able to produce antibody, if sufficient protein level is there in blood, so that they will synthesize the sufficient specific antibody against specific virus by taking specific enzymes, protein for production of antibodies, including sulfur. So, how we can stimulate this lymphocyte activity, immune system, as well as the host cells, as well as other cells of the body without harming them? That is the system we have to follow through medication in certain cases. Here we will recommend you the harmless mode of therapy which you can provide is the best system of medicine, that it is the homeopathy system of medicines. You can, after diagnosing, after the part of the investigation that the virus presence in thyroid patients, you can practice that by providing artificial immunotherapy. Virus will get neutralized. But even though after getting the neutralized of virus, some other virus also can come inside. That time also it is very difficult to diagnose and provide again artificial immunotherapy. So it is very simple and better to provide the natural immunotherapy by providing sufficient stimulation to this lymphocyte as well as host cell. You all know that what is host cell. It is not necessary to explain about host cells. But you must recommend the people in order to take their food part as delicious food, especially root foods also, which brings them sufficient parameters, electrolytes as well as protein, lipids, glycoproteins, whatever it is required for maintaining the metabolism and normal function of each and every glands and organs in the organism. So, what homeopathy remedy can provide? According to the system of the homeopathy, there is a instruction is given by the Bible of homeopathy, which is called Organ of Medicines. This Organ of Medicines, in its aphorism 31, is an instruction to all of the doctors and physicians around the world, not only for the homeopaths. It's for all the physicians around the world, that instruction. It is like this. Very, very important thing is that if you are not able to understand, if you are not able to listen to these important things, you will fail in your life for healing as a doctor, as a best doctor for your friends and society. That instruction is that, like this, unless and until a person disposed or susceptible to particular virus or inimical agent or any morbid agent, the person will not get disease. Any disease will not happen to them. Even thyroid problem, even asthmatic condition, even any cell injury, even pneumonia, even kidney disease, even lungs disease, liver disease, brain problem, heart problem, nothing will take place unless and until we dispose to certain inimical agent. For an example, I will tell you the fact that if I have the power to oppose you, in case you are going to oppose me, I will try to oppose you. But if you have the strength, a person having more strength than me, I cannot oppose him. I cannot push him because he has more strength than me. Consider I am the virus. Consider I am the bacteria. Consider I am any toxic level or any inimical agent that causes disease. So, a person having the health more than that me, he will not affected by me. Whatever the power which I have, I cannot push him because he is having the more strength than me. But once upon a time, when he will lose his strength due to many reasons, because he may be having gone through the starvation, he may be gone through any complications of intake of foods, improper food. So he may be losing his strength. That time the person doesn't have that much strength like previous state of that person, I'm able to push him down with my single stand, or with my hand, or with my single finger, or with my both hands. Easily he will get down, he will fall down, because he in that stage, because he is disposed to me. So I will affect him, I will push him down. But unless and until he lose his strength, I cannot touch him. I can go around him, but I cannot do anything. Like that, virus, bacteria, whatever may be that in our body, it doesn't make any problem if and only if we are healthy, we are not exposed to these inimical agents. For a clear clarity in that, a fact it is that a truth around you can see with your naked eyes and with your brain that except human being, no animals die because of any bacterial or any viral infections, unless and until the influence of the human being. In forest, in many places of the forest, we can see many of animals, even some human also. They don't have any problems. Birds around us doesn't have any problems. Animals around us doesn't have any problems because of virus. These virus and bacteria affects throughout their body, no problem for them, because they are capable of producing sufficient antibody in order to eliminate immediately these foreign particles. That's called virus, bacteria, whatever inimical poisons, whatever we eat. Like that, we should be we must keep our health properly. So what we used to say that, what we mean to say, what we mean to recommend you, you have to also consider the delicious food intake as a part of the life in order to produce sufficient antibody. For that, it is necessary sufficient required parameters like selenium, iodine, copper, nickel, iron, sodium, potassium, magnesium, calcium, protein, vitamins. All these are getting from foods and natural water, but after filtering. So similarly, whenever you are able to, a thyroid patient having the problem, he must follow to take natural food which contain delicious these parameters. But even though it needs some stimulation, that time we can provide certain homeopathic remedy. So I think many of the doctors and physicians are using homeopathy medicines in their daily routine life in order to heal the patients with their other mode of therapy. So we can select according to symptomatic, as well as we can monitor whether antibody is rising after giving the medicines according to symptomatic, because homeopathy medicines are proved scientifically while the drug proving in healthy persons. So it is scientifically proven that these symptoms will generate while we provide these medicines to a person for a particular time of period. So these symptoms collected and recorded homeopathy material medica. So when these symptoms match with patient symptom, we can select according to that symptoms similarness. So according to that, we can provide homeopathy medicine for the stimulation for the host cell as well as cells as well as these lymphocytes, immune system. So this can be very much helpful in order to remove thyroid complications around world. You can take also a trial, clinical trials in your area. So I recommend all the doctors and my friends, you have to follow this criteria for eliminate thyroid cases, thyroid complications to help people around you, those risk to you. My dear friends, my peoples around the world who are facing thyroid complications, it is better you ask this kind of investigation part in order to find out your complications with thyroid problem in order to bring back to the normal function of the thyroid in your life and say goodbye to thyroid problems forever. You ask your doctor in order to go through the particular test and investigation according to this phenomenon and according to this science. If your doctors are not able to do that service to you, you can write to us, you can consult with us through online consultation, irrespective of the region, irrespective of the distance in front of you. We can be there through the internet service. We can use that also by online consultation. Online hearing platform is here for us. You can write to us as the given details below and end of this communications, end of this explanations and end of this video, as well as you can see the beginning of this video. So if you are not able to reach the right place in the right doctor in order to eliminate your hypothyroidism and hyperthyroidism, even any complication related to the thyroid issues, you can approach us also for giving the direction, getting a proper elimination in order to maintain the health proper back in healthy condition. So you can write to also if you fail to reach in right place where your doctor is there. First you approach the doctor, they will help you. Otherwise you show this video to them also, they will listen to that also. After that they will take the trial. It is a proven trial, nothing to worry. Investigation is only investigation part. They will take some samples of blood, they will go through the diagnosis part to identify excess amount of antibodies, nothing beyond that. So you can simply go through that also. But even though if you face any problem, kindly you are welcome to write towards us in order to get a proper healing, in order to get a proper elimination of this thyroid complication and to say goodbye to these thyroid complications. As you know that if you are not treating your thyroid problems properly, what will happen? You know that? I think you may be knowing that. It may lead to hypovolemic stroke also, it may lead to cardiac problem also, it may lead to stroke also, it may lead to problems in many organs of your body. That is why you are getting too much angry. A thyroid patient having too much angry because there will be blockage of many blood vessels even to the brain also. If the brain is not getting sufficient blood circulation, automatically the tachycardia will take place. Why the tachycardia take place? Excessive rapid formation of the heartbeat will be, excessive heartbeat will take place while you get angry. Actually the thyroid patient is getting angry, actually it is good. Why? Because they are increasing the rate of heartbeat in order to circulate forcefully to those parts. It is very difficult to get proper circulation. When the heart will pump more and more by rapid heart beating, the chances of get at least little bit more blood circulation to that difficult part. After getting the angry, thyroid patients get relaxed. That is the reason behind they get some more excess amount of blood in those areas where it is struggle to get this blood supply. So that thyroid patients having that much voice also, excess voice, they will cry more, they will make a lot of sound, they will roar, they will have irritation. All this because of improper blood supply to every part of the body. Why? Because as we said in the earlier stage of this video, the beginning stage of this video, there will be lacking of supply of blood or partial supply of the blood is blocked because of several reasons called atherosclerosis, arteriosclerosis, stenosis, stretching, even coagulation or thrombosis formation. All this because of certain virus. I am not saying that atherosclerosis is because of virus, but atherosclerosis also can occur due to virus because thrombosis formation will rupture the inner wall, inner lumen of the arteries that causes atherosclerosis also. That will be formation of the plaque formation. Internal lumina will get breaks of the artery that will cause the deposit of lipids or any calcium deposit or any calcium oxalate deposit, whatever may be the, even in the thrombosis, blood coagulation, small particles of blood clot also will get inside the this internal lamina of the blood vessels between the smooth muscles. So there will be bulging, and normally it will get in future it will get atherosclerosis. So virus will bring the clotting. That clotting will cause the thrombosis also. So what is the main cause? We are coming to that point. If you have the virus, remove it, otherwise it will produce so many complications in your body. And even though if the patient doesn't have thyroid problem also, if there is any other problem also, you can check these parameters, antibody test for that cases also. If you have the problem with liver, if you have the problem with your lungs, asthmatic condition, any allergy conditions also, if you have problem with your renal function, kidney problem, if you have the problem with your myocardial infarction, heart failure, heart problems, if you have the problem with your brain, if you have the problem with any of the organs in your body, just remember that you have to go through a proper investigation to identify whether my body having any kind of virus which exists me for a long time or not. You can go through that, and also you can approach according to that to your doctor. He will or she will provide you the proper investigation in this line also, as well as you just give these videos to them also. They will guide. If you again you fail in that case also, in other cases also disease, you can write to us, you can ask to us by mailing or through our WhatsApp calls or through our video calls or through our hearing online hearing platform we have. So it is mentioned over here end of this video communication to you. I hope you understood well. If you have any further doubt, my dear doctors around well, if you have any doubts in this, you can ask personally to our email or direct chat with us in order to boost your healing activity, in order to boost your career, in order to do more research work in this line. So my dear friends, my dear colleagues, my dear scientists, and my dear doctors and physicians around world, be happy. At least you have a new system that you can achieve in your art of healing. Healing is different, as you know that treatment is different. Treatment can prolong for a long time, even at the end of the life of a person, but healing it will not prolong. It is immediate, rapid and gentle. It is one. and it will be permanent restoration of the health and permanent cure. It is called healing. It is, I recommend strongly all the doctors around the world, all the physicians, all the scientists, even all the people who can understand the language of English and in your language also it is available, I hope so, Organ of Medicine, which is the Bible of the medicine, especially homeopathy. Don't pull the homeopathy back. It will give you light up your life and healing. At least try to understand what actually it is. If you don't know about the homeopathy, how you can say what it is? Don't blame it. You come to homeopathy, you try to understand, because many of the my friends, many of the non and unknowing friends also is there around world, doctors is there, so they are also practicing homeopathy. But even though they will get more idea about this through this video, I hope very much thank to hear properly. It is beneficial for you. I know it very much, and we will provide more details related to this in future upcoming videos also, because nowadays it's very easy to give the videos like internet platform. So it is a distance less program. It is wherever you are, wherever we are, nothing is there, but we are unique in order to maintain the stability of the people around us. But towards the public, towards my dear friends and my brothers and sisters, I will recommend you that don't repeat your sin. Don't repeat your sin. Don't repeat your sins. If you have done the sins, that is forgiven for you. But if it is not forgiven, disease will prolong. If it's time for you, you will go through the investigation. You will find the problem. You will fix. You will remove this problem forever. So don't repeat your sins, whatever it is. But you give a proper follow of the commands given by several religions. Then commands is there around Bible, around Quran, around so many so many Vedas called Yajurveda, Rigveda, like that also. Many countries have different religions. I'm not talking about that. It depends on every culture and interest of every peoples. It is only a opinion that, but things is that you have to follow. It's only for your health. It's good for your life. It will light up your life with brightful and fearless, with great attitude towards your brothers and sisters, so that make your health properly in order to maintain your health properly, in order to eliminate whatever the disease around you. So I hope you will listen again and again. You can read and you can watch this video. If you have any doubt, you can repeat and you can hear again and again, so that you will understand more easily what we suggested. That's all here, my dear friends and colleagues. We will wind up this video here. So I hope you will understand, you will follow this instruction in order to highlight your activity of healing, which is a real healing. Anyway, thank you again. Goodbye.